Hello and welcome back to Exploring Psychology Through Science Fiction. Today we're going to be talking about THX 1138, the movie Serenity, and psychoactive drugs. First of all, before we get started on this week, I just want to apologize for the mix-ups last week. When I revised the syllabus, I didn't get everything completely straightened out, so hopefully we'll be good moving forward from here. To just briefly touch on the main topics from last week, there's really just a couple of them. The first one is the makeup of a neuron. What are the main parts? The cell body or the soma, the dendrite, the axon, and the terminal button, also known as the synaptic button. A couple other things to keep in mind is the electrical versus the chemical transmission of information in the neuron, that when you're going within the neuron, it's electrical, but going from one neuron to another through the synaptic gap is a chemical transmission of information. Why is this important? Well, more and more we're looking at the psychological disorders as being disorders of the brain. So if we don't have a working understanding of the brain, then we're missing a huge component of the science of psychology. The second topic from last week is the reward pathway of the brain. Its job is to make us feel good for doing biologically important tasks. Drinking, eating, having sex, staying alive, and procreating. It increases desirable behavior by releasing dopamine, and dopamine is really the key neurotransmitter for the reward mechanism, and that's also related to a lot of how psychotropic drugs affect our brains is by affecting dopamine. There's lots of other ones as well, but that's one of the key ones. And when that bit of dopamine is released, that gives you a little jolt of pleasure. It also, the reward pathway also creates memories of specific behaviors that make you feel good. So you remember, hey, if I do this, that feels really good to me. The thing is, this works for eating, for having sex, for exercising, for lots of different things. But when we abuse substances, that can really short circuit the reward mechanism, and it gets overloaded by drugs, which results in drug use behavior that's highly rewarded and very difficult to extinguish. Alright, so this week we're going to talk about psychoactive drugs. Now, what is a psychoactive drug? Well, it's a chemical substance that crosses the blood-brain behavior and acts on the central nervous system. There it can alter brain function, resulting in temporary changes in our perception, in our mood, in our consciousness, in our behavior. So this can include drugs of abuse like alcohol, caffeine, tobacco, cocaine, marijuana, LSD, so on and so forth. As well as medications, antidepressants, anxiolytics, antipsychotics, mood stabilizers, so on and so forth. Psychoactive drugs are a huge variety of substances that have lots of different effects on our bodies. So what's the connection between science fiction and drugs? Well, we see drugs in sci-fi movies all the time. I know I've mentioned Brave New World, and the drug in there is called Soma. Soma was a pill that was you'd take, didn't have any negative side effects. You felt great. It was like taking a vacation. The more you took, the more you felt like you'd been away and been on vacation. So this was this drug that kept everybody being as productive as possible. If they were not feeling just perfect, then you just take this drug and you don't have any hangovers. You feel like you've gotten away, gotten a break. And then, I don't know how sci-fi zombies are, but there seems to be some kind of connection, because you've got Resident Evil, which had a drug that was supposed to treat Alzheimer's, is what actually Started off all the zombies. You've got the movie I Am Legend, which is based on a book and had lots of other movies before. That was a cancer treatment that caused zombies. And then the non-zombie drugs. Dune had a couple. Spice, which was used to fold space and also expand the mind. And then Dune had Sappho juice, which was what would help the mentats be able to calculate and almost work as a living computer. Another TV show from years ago was Tech War, which was created by William Shatner. And tech was an illegal, addictive, mind-altering digital drug in the form of a microchip. And so you'd plug it in and you'd get addicted that way. Another TV show, Alien Nation, had Digitalin, I think, which was used to control the newcomers when they were slaves. It was highly addictive, and they'd pretty much do whatever they had to keep getting that supply. Recent movie, Rise of the Planet of the Apes, had a viral drug, again, that was supposed to treat Alzheimer's. Instead, it makes the apes much more brilliant. So we see, and there's so many more, but those were just some of the ones I could list out fairly quickly. But drugs play a part. Drugs have been a part of our society forever, and most likely will continue to be so. So let's talk about that first movie, THX 1138. A little bit old and trippy, back in the 70s. And to me, it is so similar to Brave New World, that it's this futuristic society, very controlled. People are controlled by drugs. It's all about production and consumption. You have very specific roles that you play. You don't deviate from that. But one of the neat things was the medications that they used in the movie. That you would open your medicine cabinet and it would say, "What's wrong?" And there was somebody monitoring what your symptoms were and what drugs you should take. But it didn't matter how you felt or what was wrong. They had a drug for it. It was the choice to fix every problem. And a way that it was different from our society was that it was illegal to not take drugs. So you were supposed to take them and could be arrested if you didn't. The mantra there was produce more, buy more, be happy. So that was their goal. It was, let's keep everyone happy and sedated and kind of numb, and that'll make the best production, the best results from their population. Now, THX's partner, LUH, she detoxed herself, and then she detoxed THX without him knowing. And the result was that they started feeling all these emotions that they had never felt before, and they weren't prepared or weren't capable of coping with those emotions. They never had to learn how to deal with emotions. It was just take a pill, feel happy, and that was it. So they were overwhelmed by their emotions and didn't know how to handle that. They ended up getting arrested for drug evasion and sexual perversion because they had sex together. So this was just one perspective that you could take on how drugs were such a huge component of the entire story, that it was all about being on them or getting off of them and the consequences of that. So it was just a very interesting way of looking at that. Move over to Serenity, and there were a couple of reasons why I chose Serenity. One is just that I really wanted to work Firefly and Serenity into the course somehow because they're great shows. But also because it provides another perspective of an extreme use of drugs. In Serenity, we find another over-controlling government, and they decide to experiment with a new drug on an entire planet. Now, the purpose of the drug was to calm the population, to weed out aggression. The problem was that it did that too well. People stopped, not only did they stop fighting, but they stopped everything else, working, eating, breathing. They just gave up the fight to live. So 30 million people just gave up and let themselves die. But 0.1% of the population had the opposite effect, that their aggression was increased beyond madness, and these became the Reavers, which were just completely out of control, cannibalistic savages. So this was, again, just another extreme example of what drugs can do, but also that desire for control. So let's bring this back a little bit to our society over the recent past and current. There's been several drugs that have really changed significant aspects of our society. One of the first ones were the antipsychotics. That instead of just locking people with schizophrenia and psychosis away in a hospital for the rest of their life, we could give them a medication and they could come out into the community and function. That one was one of the most beneficial drugs we've ever had. That it so improved the quality of life for so many people that prior to that we had no treatment for. So antipsychotics were amazing, as were the rest of these, but there were also some other aspects to it as well. The first one I want to talk about is Valium. Valium is an anti-anxiety medication, a benzodiazepine. It came out in 1963, really peaked in the late 70s and early 80s, but there was a huge marketing campaign to it. There was this push to, are you stressed? Are you feeling overwhelmed? Well, take a Valium and you'll feel better. But it was really the first marketing campaign around a psychotropic drug. Rolling Stone even had a song called Mother's Little Helper. Some of the more current benzos are Xanax, Klonopin, Ativan. Xanax is the most commonly used. And one of the most powerful aspects about Xanax is it's very fast acting. So this medication, you start to feel the effects sometimes within 10 minutes, which is very quick for a medication to take effect. So if you're having a panic attack, you can take a Xanax and you start feeling better very quickly. Now, part of that is lots of times immediately after taking it, you have the placebo effect and you start feeling better immediately because you know, hey, this medication is going to help me. But physiologically, you start getting effects between 10 and 30 minutes. So Valium was this first drug marketed to the general public that said, this will make you feel better. You'll be able to cope better. You'll be able to survive. You'll be able to deal with all the stress if you just take a Valium. And so this was really the first drug that hit mainstream, that it was okay to go take this medication to make yourself feel better. The next one was Prozac, which was an antidepressant. And it came out in 1987. And again, there was this national campaign by the drug company to start addressing the dangers of depression. So it was you need to take this drug, but it's because depression's so bad, and here's the fix. Now, it was also in response to the addiction aspect of Valium. Benzodiazepines are very addictive. One reason is because they're so quick acting. That ties right into the reward pathway, and it says, hey, taking this little pill makes me feel better, which helps me survive. So this is good, I'm going to keep doing it. But so benzos are very addictive and have a very high abuse potential. So they've really, over the last decade or so, they've really clamped down on how much they'll prescribe that and how easy it is to get it. But so Prozac came along and said it's not addictive, it's an antidepressant, and it's going to make me feel better, because who doesn't get a little depressed at times? Now again, I don't want to downplay, there are some people that really can't function if they don't have medication, but there are others that never address the underlying problem and just have to keep upping their doses of medication, and continue to struggle because they look to the pill to fix things, but they don't actually change the situation or the environment or their perspective. So we'll talk about that a bit more later, but Prozac was really the next big drug, and it's still the most widely used antidepressant. But the big key here is that it wasn't nearly as addictive like the benzos were. The third and final drug I want to mention is Ritalin. So for ADHD. Now, when I was going through school, I was taught that children with ADHD have a brain abnormality. It's back to the brain disease model that their brains weren't wired quite right, didn't have quite the right balance of neurotransmitters. They're understimulated. They get easily bored or distracted. They have trouble maintaining attention. They need lots of stimulus, and part of their acting out behavior is an attempt to provide that extra stimulus. And so the theory was, let's give them a stimulant, which is what Ritalin is. The chemical makeup is almost identical to methamphetamine. It's an amphetamine, it's speed. So giving them that stimulant provides the extra stimulation so that they can focus at school and maintain appropriate behavior. And that's still really the going theory, but there's really been a movement lately to push back on that some, because there's a number of problems with giving children handfuls of stimulants. These meds increase concentration in the short term. They do. They help you focus. I mean, that's why it works so well. It's becoming more and more of an issue of people without ADHD taking stimulants so that they can cram for exams. We're seeing that in high school and colleges, that I can take some of this and really cram for that exam and do very well, because it does increase concentration for the short term. However, there's no evidence that says being on a stimulant improves long-term school achievement, nor does it reduce behavior problems, because we're giving kids stimulants. It's going to make them more aggressive, more having a tendency to act out, more bouncing off the walls. It's not fixing the ADHD. The other concerns you have with giving stimulants to kids is it results in tolerance. So you have to keep upping the dose. It causes withdrawal symptoms. They talk a lot about one of the normal practices is to go on a medication vacation over the summer. You just stop taking it, let the kid go back to just acting how they normally would without the stimulant, because they don't need to be in the classroom all day long. But you go through withdrawal symptoms there, and actually that behavior gets even worse for a while. It also stunts growth. It affects appetite. And we don't exactly know what the long-term consequences are to the brain. I mean, you start giving stimulants, you start giving a drug to a kid at an early age, that's going to make some permanent changes. And what a lot of the studies are finding more recently is that stimulants really have the same effects for all children and adults. They do enhance the ability to concentrate, especially on tasks that aren't very interesting, or when you're tired or bored. But they really don't improve broader learning abilities. So yes, this, from an outward appearance over a very short period of time, it looks like these stimulants help kids with ADHD. But long-term learning, it's not making a difference. So we have to look at what are the benefits of doing this versus what are the consequences. And we still don't know all the consequences. A lot of research has found that there is a relationship between brain abnormalities and ADHD. Again, back to the brain disease hypothesis. And so that's what most of the research has focused on. That's what's typically funded. That's really the focus of psychology in general, is to look at that neurological and biological component of most disorders. But there's been several meta-analyses that have come out recently that suggest that there's an underlying cause to both the ADHD and the brain abnormalities. So again, it's back to this correlation versus causation issue. Is the brain abnormality causing ADHD, or is there just a correlation there, and there's actually a third variable that happens at an earlier age that causes both the abnormalities and the ADHD? And research has found that there's something there to that relationship. Possible sources for problems at an early age are abuse, domestic violence, an unstable or unstructured environment, malnutrition. I mean, there's lots of variables that can occur at a very early age that can cause the brain to rewire itself, and can cause ADHD symptoms. So the concern is that we're giving them stimulants to address this problem, but we've not addressed the underlying problem, and we're not actually fixing that either. So the concern is that what people have learned through all of these drug examples I've talked about is that life's problems can be solved with a pill. If I'm feeling anxious, or if I'm feeling depressed, or if I'm having trouble in school, I take a pill. It also puts that focus, or that locus of control on the individual. It says, there's something wrong with this kid, so we need to give him medication. Rather than looking at the environment as a whole, looking at parental behaviors and teacher skills and neighborhoods and that whole environment. How are they being affected overall? Not just, oh, there's something wrong with your brain, here's a pill, you'll do better. Because all the research says that being on a long-term dosage of Ritalin or Adderall or something like that does not improve learning outcomes. So, where does this leave us? Why am I going on my rant about all the current meds? Well, I just want to throw this out as a hypothetical. It's probably an overgeneralization, because while it does sound like I have a little bit against medication, I just have a problem with the overuse of medication. There are lots of psychotropic medications for lots of people that it significantly improves their quality of life. That people need to be on this, that it's beneficial, that it makes their lives better. However, there's also a chunk of people that don't need the meds, and would do better if they weren't on the meds and were treated in a different way instead. So I'm against the overuse of medication. I'm not against medication. Alright, so that being said, my little caveat there, my concern is that we've now had a generation in our society that's decided meds are good for controlling our emotions. I can take a Valium, I can take a Prozac, I get better, I can deal with my life. Not, I need to deal with the anxiety, I need to learn how to work through my issues with my significant other, I need to decide to get a new job, whatever it is, whatever causes some of that. I just take a pill and I feel better. Nothing's really changed. So what happens is I have to start taking a pill more often. I have to start taking larger doses of the medication to get that same effect of, okay, everything's good again. So we've got a generation that's starting to look like that, and it's not everybody, but it's become much more common in our society. It's a much more accepted way to cope. Now, that generation has had kids that some of them have been on Ritalin their whole lives. So we're now 2 generations in, with people learning and recognizing and seeing parents take a pill whenever they're flustered, being told to take this pill each day to do better at school or to not be as problematic at school. So we're now 2 generations in of meds are good, meds help, meds are the way to fix my problems. And again, some people need those, but lots of people don't. So my concern is that one of the biggest areas that we're seeing addiction grow is in the use of prescription pills, which are typically the opioids, the pain meds, and the benzos, the anti-anxiety meds. So the opioids, that's the same family as methadone, as heroin. So we've got kids that have been on Ritalin their whole lives, and again, you develop tolerance, so you have to keep taking more and more. Well, okay, what about some of these other pills? If I have any inkling towards addiction, I'm going to say, okay, if one's better, or if one's good, then 2 or 3 is even better. So we've got a lot of kids with potential for addiction, happen to be some of the ones that are on Ritalin, and then that starts going into the other pills. And so we're seeing a huge increase in prescription pill abuse and heroin abuse. And some of it, I think, relates to how their brains have been rewired, the reward mechanism, how that comes back into play when they've been taking these stimulants all these years. And now I've got to move on to the bigger and better one to keep getting that burst of pleasure. So I guess somewhat of a paranoid way of looking at this is that our society is already going towards that direction of using drugs to control people. That we've got addictions still just as much, if not more, of a problem now as it was in previous generations. We've got more people than ever taking prescription meds, psychotropic meds, not just some of the health-related ones, but the psychological aspects. More people now, a higher percentage of people now are taking them than ever before. And when it comes through prescription meds, it's seen as being okay. It's kind of the same argument as with alcohol, that, well, alcohol's legal, so it's okay to use. Whereas the hard drugs, oh, they're bad, but alcohol's fine. And that's the concern about legalizing marijuana as well, is that opens it up to a whole bunch more people, because they say, oh, well, it's legal, so it's okay, it's not going to hurt me. And while we can argue, is it more or less harmful than alcohol or tobacco or any other drug, it still causes lots of problems for people. So when we sanction something by making it legal or by prescribing it, I mean, with the prescription pills, we've got a doctor saying, this is what you should take, this is your treatment. And so it's okay to do this. I'm doing this like the doctor says. Well, maybe I have to have a few extra ones here and there, or maybe I have to go buy some more in between, or hit a couple doctors up at the same time to get as many as I really want. It's okay because the doctor said so. Alcohol is okay because it's legal. Marijuana is okay because we're making it more and more legal. We're giving permission to become addicted, and that to me is very scary. So where are we going from here? Well, if we start looking at the future societies, get the sci-fi back in here, we've got a higher percentage of people taking meds, psychotropic meds, than ever before. A couple years ago, the number was 1 in 5 people are currently prescribed psychotropic meds. That's a pretty high number, because if you take the percentages of what we think the rates of different disorders are and add them all up, it may be approaching that, but it means that a lot of people are taking meds right now. Some of them need it, but some of them don't. And so down the future, what's that going to look like? It's probably just going to keep increasing. The more meds we get, the more effective meds, the more sophisticated meds that are designed with fewer side effects, faster acting, longer lasting, great marketing campaigns to boot. There's most likely just going to keep, those numbers are going to keep increasing. So what do we do? Well, I think there's two things that we really need to look at. One is that we reevaluate the use of medication as the primary treatment for psychological disorders, because it is. The first stop is to go to your primary care physician, say, yeah, doc, I'm not feeling so good. Okay, well, let me write you a script for an antidepressant. It's a little harder to get the ones for anxiety, but you can still find a doctor that'll do that. So instead of going to therapy, and of course I'm a psychologist, I'm biased, but there's also research that says that for a lot of problems, therapy is more effective than medication. Just a couple days ago, a large meta-analysis was released that said that cognitive behavioral therapy is more effective for social anxiety disorder than medication is. There's been lots of studies showing that for lower levels of depression, therapy is more effective than medication. It's when you get to the more severe end of things, the severe depression, that the medication is crucial. The more severe side of anxiety, PTSD, the more severe schizophrenia, psychosis. When it gets really severe, meds are going to be a part of the treatment. But for the lower level, and those are the people that are just seeing the commercials, are you depressed, or are you anxious, or are you anything? Well, then you might have this disorder. Go ask your doctor about this drug. Those are the ones that go in and get that script and start taking it, because this is easier than going to therapy every week for months on end. I can just take this pill and I feel better. So we need to really reevaluate how we're approaching that. And then the other thing is to make sure that we make addiction a public health priority. Addiction's a brain disease. Also environmental stuff, just like I was talking about earlier with ADHD. But this is a real disease. But there's still that stigma attached to it, and we've got to overcome that so that people can get the help that they need to improve their quality of life. We need to focus on prevention. But with treatment, we've got 1 in 10 people in a given year meet the diagnostic criteria for substance abuse or dependence, a substance use disorder. But only 10% of those actually go into treatment to get help. So 90% of the people that need help aren't getting it because of the stigma, because of lack of access to treatment, because it takes work. But keep in mind, substance abuse treatment is effective. So we need to get people into it. So that was my spiel. Take-home message is drugs are good, but drugs are also bad. And we really need to walk that fine line because lots of sci-fi likes to look at what's that future going to look like when we start becoming more and more dependent on drugs as a society. Not just abusing drugs, but that drugs are the treatment for everything. So, for this week, go check out the Mouse Party for this week. Sorry about the confusion from last week. And then go to the ASU Health and Wellness site and take the eCheckup to Go assessment. Takes about 15 minutes, I think, and it gives you a printout. It's really cool to look at what your patterns are compared to what the norms for our university as well as countrywide are. Take a quiz, jump in on the discussions, and next week we'll be talking about artificial intelligence and Battlestar Galactica. Have a good one. Bye.